Taiwan reported 744 local COVID infections on Wednesday, the highest single-day figure since the start of the pandemic. New Taipei reported the highest number of cases at 264, followed by Taipei at 141.
The CECC also reported 3 more patients with moderate COVID symptoms who are all in their 80s and have pre-existing conditions. Despite the surge of local cases, the vast majority has had light or no symptoms.
On Wednesday, Taiwan reported its highest daily case tally since the start of the pandemic at 744 local infections. Taipei and New Taipei both reported more than 100 cases, 264 in New Taipei and 141 in Taipei. Meanwhile, Taoyuan, Keelung and Kaohsiung each reported more than 50 infections. Across Taiwan, 10 counties and cities reported more than 10 infections each.
In
the early development stages of the outbreak, we saw 3 days with cases in the 400s. Then it went to more than 500, and now we're seeing more than 700 cases. The upward trend is undeniable. It's hard to predict what the peak will be or when it will happen.
Taiwan's medical infrastructure, including specialized wards, negative pressure wards, centralized quarantine centers, and enhanced quarantine hotels, still have about 5,300 beds available for COVID patients. The CECC says it's planning to allow patients with mild or no symptoms to isolate at home in the future. Patients in home isolation will be able to access traditional Chinese medicine treatments if they so wish.
The NRICM 101 compound's effectiveness has not been affected by the different strains of the virus. It's always been a good option. It's just as good against Delta as it is against Omicron. Sometimes vaccines might not offer their fullest protection to some people, such as people with autoimmune disorders, so they might have some gaps in their defenses, which can be filled in by NRICM 101.
As of Wednesday, Taiwan has received 5,000 courses of Merck's COVID oral pills. The CCC has also placed orders for more than 15,000 courses of the Pfizer treatment, which will be delivered over the next 2 weeks.